If you lose all your hair before you're 20.
Welcome to the Q&A session. Today I will be taking on the processes involved in hair transplants. Often I get asked, oh, what should I expect? What's done in the procedure? What happens after the procedure? So I'll just briefly run through what to expect. So typically the journey to hair restoration surgeries begins with your research. So you want to research it. Research typically these days involves going to the internet and doing your search, which is a blessing, and it also be not blessing, because the internet has a lot of information, but then you also will get faced with so much information. Sometimes the views are contradicting, and then you become overloaded with information and not know what to choose or where to go. But the main thing is, first thing is know what you want, what the problem that you have is, and you know what your goal is. And then yes, do research, go to internet hair loss forums where people with hair loss that have undergone transplants go in there to chat and discuss their experiences, so you can pretty much learn a lot from that. When you do your research, you're invariably going to have to end up going to the websites of some doctors. The most important thing there is to really look at the results critically. Make sure that results are authentically presented, so you can use any one logical method to determine if the photographs look genuine, an accurate representation of what the result is. Also, in this day and age, you should actually also look for videos, because videos are more authentic, because with the videos you can see movements. It's not just one fixed favorable view. You may want to see how the hair combs through, you want to see the hair in action, and also maybe even catch a testimony from the patient. So that's something you should look out for. In terms of transplant, you want to know what method the doctor uses. So is it an FUE or a strip? And if it is, say, FUE, which is what most people prefer these days, you want to make sure that the results displayed in the result gallery of that clinic are results that were derived using FUE and not the older method. In your research, you don't be shy to go and actually see the doctor. When you go to the clinic, one thing you may want to do is insist on seeing whoever is going to perform your procedure. So if it's a doctor, then you really want to see the doctor. A lot of clinics have salespeople or consultants that have no medical background actually do your consultation. That is actually not a good idea. You want to deal with a medical person, especially the person who is going to be performing your procedure. So be it the physician, the doctor himself, or your physician assistant. You want to see and talk with them. You want to ask them questions and have your concerns addressed directly by them. You don't want to be dealt with by somebody who just benefits or gets commission on by virtue of the fact that they're able to get you to commit to surgery, and that's really not the right atmosphere to work with. Having done your research, in fact, if possible, if you want to see a patient that has undergone treatment at that clinic, that may not be a bad idea. Often that is not necessary, but if it takes that to convince you, by all means do it. And the next step would be to go ahead and book for your surgery. So you go through the clinic, you've made up your mind who to go with. You now go through the protocol, the processes for booking. I would discourage you from having a procedure the same day you're doing consultation. And there are clinics where you can just walk in there. The salesperson typically tells you how many grafts you need, and they tell you, oh, we have a place, just go in to the back door and have surgery. And that's really very common. I will strongly discourage that. If that ever happens, first of all, that's not a good sign. But even if you decide you want to have surgery, don't do it the same day. Go home, take your time, mull it over, think about it, and if you then decide, and then book a date and do the surgery. No rush. Remember, this is a result you will carry for the rest of your life. Once you book for your surgery, on the day of the surgery, you should expect again to see the staff that will be performing your surgery, and also to talk to the doctor or physician assistant that will be performing your surgery. You should go again once more over the plans of what you want to have achieved, just to make sure that there is no misunderstanding. And then you'll probably go through the process of getting your medication, a haircut, and having your surgery performed. Of course, we assume that you've already signed your consents. You should typically not go through your consents on the day of the surgery. You should do it several days ahead of the surgery, so you understand all that is involved in there. You do it well informed with your eyes open. And on the day of the surgery, you're likely to get a haircut. You're likely to be made comfortable on an operating table or chair. And if you're doing FUE using head hair, you're going to be positioned in such a way that your doctor can access your head. So you may be laying forward on a chair or laying on a massage table kind of posture. The process begins usually by the numbing of the donor area. So the area where the hair will be taken from will be injected with typically lidocaine with something called epinephrine that will numb that area. If you are doing FUE, your doctor will be using the instrument of choice for him or her. It could be a manual device, it could be a semi-automated device, it could even be the robot that they may be using. Obviously, during your consultation, you want to know what method is being used. Do not find out on the day of the surgery. Typically, what will happen is hair is harvested in one go and then stored temporarily in a media. And then after a very brief period, when the donor extraction is completed, your doctor should make incisions that have the final design in mind, because it is the incisions that are made will determine the angles of your hair, it will determine the pattern of your restoration. It's the artistic part of the process. Your doctor will probably perform that at that point, and then typically the assistants to the doctor will place the graft into the slits or holes that the doctor has created. These technicians or medical assistants are typically trained either elsewhere or by the doctor that is doing your surgery. Often they are well trained and probably experienced in doing that. Many clinics will have the same people planned in doing this task day in, day out for years. During the procedure, it's likely that you'll be taking breaks to go to the bathroom. There may be even time for you to break for lunch, or depending on the time of the day. Often with FUE, you are relaxed, you may be even watching TV at the time the grafts are being placed. You may be conversing with your providers. In my clinic, I do give some sedation to make the day go faster, because in FUE it's quite a long day where you'll be required to stay still, and that could be quite uncomfortable and difficult to do for a sustained period of time. So we do encourage patients where it's not contraindicated to take a little bit of sedation, so they're less anxious and the procedure is more tolerable and more comfortable. At the end of your procedure, you're probably going to get photographs taken. Oh, by the way, you probably had photographs taken before the procedure, and you will be given typically your discharge instructions. In my clinic, we give you the discharge instructions in writing, and also somebody will go through it with you and or the person that is accompanying you, just to reinforce the message, to make sure nothing is forgotten. And if it's given to you in writing, you can always go through it again, and if you have any questions, you can then ask. That done, you leave for home, and you will go through a process of your recovery, and then you follow up with your clinic. You need to keep in touch with your doctor or the clinic, appraising them of your progress, and if you have any concerns, you should notify your providers immediately. No matter how minor you think it is, there's nothing wrong in clarifying and making sure that you're on the right course of doing things. Your results will typically start manifesting at about 4 or 5 months. Typically by 7 months, you should have something you can carry around and show off. But the final result starts manifesting at about the 10th month. For most transplants, it takes about 18 months for your hair to fully grow out and undergo the changes in its characteristics that will make it blend better with the rest of the hair surroundings. So I hope that little narrative puts you through the journey that you expect to undergo if you are to commit to hair transplant. Thank you.
Pick up the phone, make an appointment for you. Pick up the phone, make an appointment for you. Pick up the phone, make an appointment for you.